A root canal therapy is the procedure of removing dead infected tissue from the inside of a tooth, then attempting to clean, sterilize and fill the canal which runs down the center of the tooth. The dental profession call this saving a tooth. The first step is to drill a huge hole through the crown of the tooth. The pulp chamber is exposed and cleaned out to gain access to the top of the root canal. The canals are then scraped out using files of increasing diameter to remove dead tissue from the inside. In this process, some of the debris and bacteria will be forced through the end of the root into the surrounding bone. Further scraping and filing is done to widen and shape the canal for the final filling. The length of the canal is judged by taking an X-ray of the tooth with a file inside the canal. The difference in length is then calculated to estimate the correct root length. This is at best a good guess, as dentistry has still not found a way to measure the length of a root canal with precision.
The next step is to try to sterilize the tooth. This is done initially by washing the inside of the tooth with hydrogen peroxide and sodium hypochlorite, the bleach used for cleaning dirty nappies. A concoction of medications is placed in the tooth and the tooth is sealed with a temporary filling. The most common medicaments used for this are camphor, phenol, menthol and formaldehyde. These have been used for over 100 years. This process is repeated until the tooth stops hurting. When the tooth is considered sterile, it is ready to fill. Slow-setting cements are spun down the canals. Gutta-percha points are inserted next. They're packed in tightly to try to completely seal the canal. Supposedly, this will stop bacteria from getting into the tooth and reinfecting it. A temporary filling is then placed in the crown of the tooth until the final restoration can be completed.